infectious disease experts say this level of readiness across the U.S. is only now being addressed.
We've seen that hospitals now are downloading paper-based guidance plans from the internet, and they're now working out how to do the management, how to do the implementation, how to make these things happen to ensure that if they do unfortunately get an Ebola patient, everyone in the hospital is going to be safe.
And it's not just hospitals that need to improve their response. This December 2013 study by the Robert Wood Johnson Foundation and Trust for America found a majority of states scored poorly in their ability to control infectious diseases. The study's executive director quoted as saying, "The bad news is that we found major gaps in the country's ability to prevent, control, and treat outbreaks, leaving Americans at an unacceptable level of unnecessary risk." The report calls for more uniform vaccinations, better health monitoring, and much better communication between hospitals who possibly have infectious patients and the health officials who can stop those infections from spreading. Drew Griffin, CNN, Dallas.
And joining me now is infectious diseases and public health specialist Dr. Celine Gounder. She wrote an article about why high-tech medicine alone cannot protect the U.S. from Ebola. Dr. Gounder, in your article, you talked about how important it is to get the basics right. What do you mean by the basics?
Well, one of the most common causes of medical errors in this country is communication. And some people are blaming these electronic medical records as being the problem here. That's a way of recording information, but it's not communication in and of itself. And unfortunately, what really should have happened is the nurse should have said to the physicians, "I am really worried here. I'm concerned this patient could have Ebola," and that didn't happen.
Instead of putting it into a computer, there needs to be more of a face-to-face
There has to be face-to-face
discussion.
communication.